Well, elder care right now is a really important issue in the United States and really across the world, because there's so many people that are living longer, and our elder care population is just booming. It's huge. It's bigger than it's ever been. My name is Marion Kremen, and I am a licensed clinical social worker. I'm the director and the owner of Visiting Angels Santa Rosa. What we're finding is that more and more people want to stay home or want to stay in environments where they're more comfortable and where they can live a higher quality of life. So it becomes important to respect their decisions about how they want to live. So with knowing what elders are needing at this time in their lives, Visiting Angels, the service that we provide, is senior home care. We provide care for people that really are interested in staying in their homes for as long as possible. We have wonderful, compassionate caregivers that are skilled in caregiving. It's not something that everyone can do, and we can assist people either a little or a lot to stay in their homes comfortably and safely.
I love this job because I've always been a people person. Helping people is just rewarding to me. You know, you can't find that type of reward from anything else, and providing someone with care is just makes me happy.
What was impressed about all the caretakers were the fact that determination and their dedication to my well-being. I thought that was over and beyond the call of duty. But she helped me with making the bed, doing the dishes, things like that that gave me some wanting to go further. And so far, it's been all up.
Wasn't that cool? That was cool.
That was a lot of fun.
You do develop a relationship closely like a good friend. And they're always an uplift.
I think the benefit of hiring an employee-based agency like mine is that you are getting a caregiver who's been screened, background checked, and reference checked in a professional manner. The other benefit is that we take care of all the legal requirements like payroll taxes, workman's compensation, and we have liability insurance and bonding.
I love my work, and I love my work because people call me completely overwhelmed. It's not uncommon for an adult daughter and sometimes even the son to cry during our initial phone call because this has been a big burden, and they're finally beginning to get some help.
But I think when someone is choosing to die at home and a family is wanting to support that desire, they might be at a loss as to how to make that happen. So for example, one of the medical needs somebody might have would be nursing care. Some of the non-medical needs might include a home health aide who can tend to that person's personal care. If people can't get out of bed, they still like to be bathed, and so a home health aide can offer bed bathing. A home health aide can do some gentle massages for people. A home health aide can do some light housekeeping to help that family, again, be with their loved one and be with them in a way that's not stressed.
I would say most of the adult children that I work with have a decent relationship with their parents and do want to provide the care, and it usually starts small. Sure, Mom, I'll help you. I'll take you to the grocery store. I'll throw in a load of laundry. I'll take you to the physician's appointment. I'll get the medication. I'll help bring in the meals, and it just sort of snowballs so that what was a workable situation in the time life of the daughter or son providing the help becomes unmanageable at some point, and there's a tipping point for them when they feel really overwhelmed and they still want to help, but it's really time to call an outside provider.
For families that call us that are looking for care, usually they're in crisis, and the first things that I look for are what can we do that day to give them a small plan that will allow them to get through the night, literally. When a call comes, I'm on call 24 hours around the clock, as are other members of our staff, which means that if someone has an emergency and they're being discharged from a hospital, we need to get to the home by 2 o'clock in the morning. They actually will get a person on the other end. They're not going to get an answering service.
So if you think you're needing this kind of care, we at Visiting Angels Santa Rosa, we have caregivers that service all of Sonoma County. So please give us a call or visit our website. We'd love to come by and offer a free in-home consultation. Just sit down and talk to you about what your needs are and help you come up with a plan of care.